Good day and welcome to this presentation of spinal injury, pain, and dysfunction. And we will talk about how injury happens, why pain is prolonged after an injury, and also how do you recover from these types of injuries. First of all, how do injuries happen? Usually it's a forceful trauma, such as a car accident or sport injury, like in football, you get hit really hard or you have a big bad fall down the stairs, or even lifting heavy objects can cause injury. What happens is that the force is stronger than the tensile strength of the tissue or the muscle tissue, and the muscle actually tears and causes bleeding and swelling inside the injured tissue. Also, other than just large trauma, you can have actually excessive small traumas that actually accumulate over time. So repetitious movements, such as if you had to shovel a ditch all day, shoveling a few things a few times doesn't cause any problems, but shoveling the same motion over and over again will cause repetitive strain on tissue that can cause damage over time, or even lifting small things over and over again. Poor muscle control and poor balance can also lead to injury. They've done research, medical research shows that people who have poor balance, who tend to fall, not necessarily fall to the ground, but just not very steady on their feet, tend to injure themselves more often, especially the spine. Sometimes patients come into the office saying that they were just bending over to pick up a sock or a shoe off the floor, and that resulted in tremendous pain in their back, or even just turning your neck. Sometimes people say that they turn their neck one way and then suddenly they were in intense pain. Again, it's poor coordination of the muscles that are adjacent to the spine that causes kind of problem. Also, if you sit or hold a posture or sit still for too long of a period of time, holding the same posture, such as sitting at a computer, or even if you slept in the wrong position, these things can also cause injury. The prolonged posture is more like a repetitive injury, like seen up here in the second portion of the slide. Next, let's talk about what medical research has discovered what injury can lead to. Uh, Again, once you have injury, regardless of the cause of the injury, you get tissue damage, you get muscle tearing and ligament tearing. And often that can lead to swelling and pain. And swelling is actually fluid that should be inside the bloodstream, but when blood vessels dilate as a result of injury or get torn, fluid that is supposed to be in the bloodstream, in the veins, in the arteries, in the lymphatic system, actually can leak out and cause swelling. After this, we can have loss of motion. Every time you have pain and swelling, the muscles go into spasm, and the mobility of the joints, of any joint actually, the elbow or the shoulder or the spinal joints become stiff and locked. This slide talks about how spinal bones become jammed because of small muscles in the spine go into spasm. We see here on the left-hand side how many tiny little small muscles, these little red portions here, that go from one vertebrae to the one above it. Now we can see that in the picture in the middle, that often if only one side contracts, if the muscles on this side of your spine, the right side of your spine contract, because that's the ones that got injured, the spasm actually causes the joint or the facet joints between the bones to lock up and jam. And if you look at the picture on the right hand side, they drew, like, it looks like strings that go from bones from below to bones above, and that's what the muscles are acting like. They're acting like tight strings or ropes that are under constant tension that start to pull vertebrae out of the proper alignment and cause jam and loss of motion. So let's go back here. Loss of motion, jammed bones, and spasm lead to decreased activity because it hurts. It hurts. You don't want to move when something hurts, so that things become immobile, the joints become immobile, the bones become immobile, and you don't use them, or you have disuse of the joints. Now, anytime you stop using joints, if you don't use it, you'll lose it. You lose function of the joints, and then they start to wear out and decay. Now, if you stop using your joints, what happens to the muscles around it? The muscles become weak, the joints become stiff, and if you're not moving around and not exercising because your joints hurt and your muscles hurt and your muscles are weak, that often will lead to decreased heart and lung function and fitness, that your lungs will not be able to bring oxygen into your bloodstream as sufficiently as they should, and also your heart pump. The muscle tissue of the heart does not gets weaker and weaker. So we can see that how this, so far, how just an injury to any part of your body, especially the spine, can lead to a cascade of different things. Muscle weakness leads to poor coordination, balance, and joint stiffness. Again, leads to more decreased mobility. That you just can't move like you used to. Now, we've talked earlier that poor balance of muscle control leads to more muscle shrinkage and atrophy, and also further weakness. And the decrease of motion, when you have an injured joint, an injured muscle, what happens is that the muscles do not heal with more muscle tissue. When you tear and destroy muscle, what replaces the muscle is scar tissue, or adhesions, or fibrosis. And we'll look at a slide later on that talks about what fibrosis or scarring looks like inside the joints and inside the body. So, moving on, muscle atrophy, which is shrinkage of the muscle, scarring, and decreased function of the lungs and heart, all can cause chronic or long-term continuing pain. You hurt yourself 3, 4, 5 weeks ago, and it still hurts. And people often wonder, why is it still? It should be better by now. It just hurts. And they often describe how the pain just gets worse and worse and worse as time goes on, instead of getting better and better. And unfortunately, this is more common among patients as they get older, over 40 years old, that their healing mechanisms are not as good as they were when they were younger. So again, all these problems can cause continued, long-term, continuing chronic pain, muscle and skeletal dysfunction, and your muscles and joints just are not working and not as flexible as they used to be. And when you have this condition, the stiffer you are now, the increased chance you have of re-injuring those same areas in the future. Also, when you have this chronic jamming of joints because the muscles do not allow the joints to move smoothly, the jammed joints grind the cartilage away, and that leads to joint cartilage damage, and in the long run, joint cartilage damage is actually arthritis.